and welcome back to the video series awareness campaign with the Maryland Healthcare Coalition Against Domestic Violence, centered on the intersection of health and intimate partner violence. My name is Lauren Doherty, and I am the Training and Outreach Specialist with the Healthcare Coalition and your host for this video series. Today I'm with Sydney Palinkas, Community Outreach and Education Manager of the Elder Safe Center at Charles E. Smith Life Communities. In honor of June 15th being World Elder Abuse Awareness Day, Sydney is going to be telling us more about elder abuse and how it intersects with domestic violence. Sydney, can you start by telling us a little bit about what elder abuse is?
Sure, thanks, Lauren. So the term elder abuse is used to include all mistreatment against older adults, including physical abuse, emotional abuse, sexual abuse, financial exploitation, neglect, and self-neglect. We see these forms of abuse show up a bit differently with older adults than we do with younger survivors. For example, abusers might control the older adult's access to their assistive devices, like their hearing aids or their walker. The abuser might purposefully over or under medicate the older adult or withhold proper medical care. And it's important to remember that while underreported, sexual abuse does happen to older adults. Elder abuse can occur in any setting, like private homes, a community setting, like a senior center or an adult day center, or in a facility, like a nursing home or assisted living. Elder abuse is most often committed by someone the older adult knows well and trusts, like a family member, a close friend, or a professional caregiver. In many cases of elder abuse, the abuse is committed by an intimate partner. Too often we think about domestic violence as being younger couples, but it doesn't just stop at age 60. We see survivors that have been in these abusive marriages for decades. And cases can become even more dangerous if the abusive partner is now the primary caregiver, making the survivor extremely vulnerable.
And Sydney, can you talk a little bit more about the impact of elder abuse and its prevalence?
Sure. Elder abuse has a devastating impact on those that have experienced it. Of course, physical abuse and neglect can cause serious health effects, but so can emotional abuse and even financial abuse. Individuals are at a 300% higher risk of premature death after they experience elder abuse. They're more likely to need nursing home level care and more likely to be readmitted to the hospital. They are more likely to experience depression, anxiety, PTSD, suicidality, and cognitive impairments. In terms of prevalence, studies have shown that 1 in 10 older adults is experiencing some form of abuse in the community. However, only 1 in 24 cases is ever reported. That's why it's so important that healthcare professionals know how to screen and report for elder abuse.
And what is your advice to health professionals around screening for elder abuse?
So there is no gold standard screening tool in the elder abuse field. There are a lot of great tools out there. What's important is that you and your team have a tool that you will actually use. Screening should be routine for all patients. Remember to always talk with the patient alone. You should be asking non-judgmental questions that allow for a broad range of abuse types to be disclosed. Even individuals that have cognitive impairments can still accurately report abuse. So it's important to not disregard those reports. Some older patients may not be able to self-report or may be afraid to. So it's important to also know the warning signs of abuse. You want to look for suspicious, unexplained, or untreated injuries, signs of dehydration or malnutrition or poor hygiene, depression, anxiety, low self-esteem, or any changes to someone's mood, behavior, or their financial choices.
And then lastly, can you talk more about reporting and what it means to be a mandated reporter?
Sure. So in Maryland, healthcare and human service professionals are considered mandated reporters of elder abuse. However, Maryland law focuses on vulnerability, not on age. A vulnerable adult is defined as someone 18 years and older who lacks the physical or mental capacity to provide for his or her own daily needs. However, not all older adults are vulnerable, and not all vulnerable adults are older. So when determining your role as a mandated reporter, consider the physical and cognitive abilities of your patient, not just their age. If you are obligated to report, you should report to the Adult Protective Services within your jurisdiction.
Well, thanks again, Sydney, for sharing this really vital information for us. For those of you who are interested in watching other videos with experts in the field or learning more about how to create an effective and proactive response to intimate partner violence, please visit our website at www.healthandb.org.